Hi, everybody. Welcome to another FaithBridge family gathering. I've been looking forward to this time because it has to do with good news. You heard me say yesterday at FaithBridge Home Church that we've been tracking these numbers in Houston. They've been trending pretty well. We're down now in that 600 level that we needed to be at for people that are hospitalized because of COVID, and that was just a request, never a mandate. No one has taken any of our rights or privileges away. We just voluntarily felt that to follow Christ, this would be the best way for us to sacrifice. At that, though, we feel like it's time to reopen. We believe that we can do so safely. Just to check my wisdom on that, I asked Dr. Marc Boom of Houston Methodist if he would join me again for a brief interview. He was gracious to do that. We did that a couple of days ago, and I think that you will enjoy hearing the things that he talks about. Let's go now to that interview. Dr. Marc Boom, CEO of Houston's Methodist Hospital. Welcome back to FaithBridge.
Thank you. It's good to be here.
Well, we owe a debt of gratitude, our whole city does, to you for all the leadership you've been giving us in this very unique era. So, you were giving some coaching to a group of pastors that I was part of back in July. The numbers of the hospital beds were 2,400, as I recall right then. You were explaining it's not so much the bed space, it's the nursing and the doctor bandwidth. We just can't run out and get 1,000 more of them like that. If we shot up to 5,000, everybody said, well, let's hold. We've been holding. We've been watching it. Things have been going down nicely. I think we're in the 600s now. To what do you attribute that progress that we've made as a city?
Yeah, thankfully we've made a lot of progress, and certainly the nurses and physicians and others, are feeling a lot better about the situation now. We are not out of the woods, and frankly won't be till this pandemic ends, and it's not going to end without a vaccine, most likely. So one key message will be, don't let your guard down. And now's really, frankly, a terrible time to let our guard down, just as we've worked so hard to get these gains. But if we look at what happened and why we did much better, it really comes down to community behaviors, and it particularly comes down to masking, which of course, are in and of themselves critically important, but also a signal to everybody that, hey, life just isn't quite normal, and let's remember to be cautious. If you look at the timing of things, go all the way back to the first phase, and it was about 18 days after the whole, broad-based community shutdown, which of course none of us ever want to repeat again if we can at all avoid that. And I truly believe we can. So you go back then and you look at late June, and things were really spiraling up out of control. It was a pretty bad time in our community, much worse than anything we experienced with the first phase. We saw, at Houston Methodist, about quadruple the number ultimately of beds being used at that point than we did in the first phase. Put that in perspective, the most beds we'll ever use at Methodist in a flu season, on an average flu season, is probably at any given time about 100 of our 2,400 beds. In the worst flu season we've seen in a few years, we at peak used slightly fewer than 200, which is not quite, but almost what we used in that kind of first surge. We used 800, 850 this time around. And that puts tremendous stress on the people who work here, on the system, and, frankly, crowds out the ability to care for all the other patients who need care in the community. And so, not a good place to be. So if you look at the timing, though, we had a two-phase masking order that happened. The first was when authority was given to put a masking order inside of businesses. And then on July 3rd, we had the full-fledged mask order. And you can look at those timings, and really to get to the beginning, and we actually ended up sort of flattening out and hitting a very, very high-level plateau for a long period of time, right about July 4th weekend. And that really is attributable to a June 19th first phase masking order, which did help manage to level things off. Then you look at the July 3rd masking order, you you go out and you're in that about 2.5, 3.5 week, right in that time frame period that we began to start coming down. And once we came down, we started coming down pretty rapidly, not as rapidly as things went up, but coming down. And so, now we're at about a quarter of our peak, maybe 30% of our peak, still pretty high, but nothing like before. And so we're in a much better place, and continue to see positive signs for that. Although, we have to be careful not to let our guards down now, or it'll just go back up.
Sure. Well, and it's timely for us to talk because this is Labor Day weekend. And I remember, well, you were just pointing out July 4th, and before that, Memorial Day, things really soared. What advice for Labor Day weekend should we be particularly careful about as we think about gatherings and such?
Yeah, that's a real concern for us. There's no question when you look back that Memorial Day was a big factor, and it was Memorial Day itself and sort of that whole signal that everybody felt that, hey, life is back to normal. It's summer. Let's try and act like this thing never happened. And of course, that came back and really bit us as a society. And clearly that was, not the right thing to do together. July 4th was a lot better, although we still saw in the data some surge post July 4th. But clearly, both anecdotally and I think from the data, we saw much better. We have to be sure that this weekend that we continue to have the diligence. We can't allow a weekend like this, to let our guard down, say, hey, summer's ending, let's go celebrate that. Things seem to be better. I worry because, of course, we're in that same kind of mode with the virus where things are doing better, but not quite as good as they should be or could be. And we haven't really had the diligence and persistence to get it truly in control. And I worry that we let our guards down. So the same advice we'd have given other times, which is, obviously all of the safe behaviors we would normally exhibit, and then really figure out, please, how to refrain from large gatherings. We really, have a problem when we see large gatherings of people getting together. So many of the stories we've seen of people in our ICUs, of people sadly passing away many times, have been family gatherings, close social circle gatherings. But once you get that group of people from a bunch of different households together and do that, generally in a, hey, I trust them, or they're my family members kind of way, you've now connected all of their social networks, all of their, work networks and everything else. And if you don't use caution, you don't wear a mask in those settings, you don't socially distance, then you have outbreaks. And so we worry about that. And so I'd urge patience and caution. My biggest goal, and I've said this before, societally, is we need to get kids back into in-person learning when it's safe. To me, a lot of other things have to be put on hold so we can meet that goal and do that safely. Celebrating over a Labor Day weekend is one of those. And there are ways to do that safely outside with very small groups, with decreasing risk, but no large gatherings, hopefully.
Yeah. So let's talk about this just a minute, because large gatherings, I tend to think of churches, certainly our size church, as well as schools. I know from our area, our superintendent is and the whole board of the school district are being very careful, and they're going to require all the safety protocols, the mask, and building in as much distance as possible. We're doing that at church, and are going into training now, hardcore, to get ready for the 20th. Do you think if we will just do those things, and which means that we have to die a little bit to our own selfishness, that we can maintain a new normal until we get to a vaccine where we could keep things open and running at this point?
Well, obviously that's all of our hope. And so, and I do think with diligence, a lot can be done. So we've seen that opening up the economy, that bringing people back into places of work can work. I mean, it can function. We've had people doing that for months at the hospitals, and I've talked to many employers who sit there saying, hey, I want to move things forward. And I think we are an example of when you put the good practices in place in our workforce, we're not having big groups of infections. And I wholeheartedly agree that is achievable. To me, our number one goal is get schools opening. There's different timeframes, different school districts making different decisions. What we've been trying to guide from the medical center is that we wanted to see the numbers really get much better. So if you had asked us 3-4 weeks ago, we were like, no, let's not do those kinds of things. we're still not at the point where we're saying, yeah, let's go, let's, pedal to the metal. But fortunately, we're moving so far in the right direction. And I'll put some caveats on that in a second, because, we can lose ground very quickly. This virus has shown that to us. But what we've said is we want to see, three things happen. We want to see the spread factor. What's the R? And my simple way of thinking about that, it's a single digit, it's a one number. One or less is good, one or more is bad. What that basically says is, if I get the infection, how many people on average am I infecting? And anytime we have in a pandemic that number less than one, that means actually the virus and the situation starts to sort of peter out. It may not go away, but at least it starts to diminish. And anytime it's above one, you can get in trouble. And we've seen that. A typical flu has an R of, call it, 1.3 or so. This virus doing nothing in society has a R probably of 3 or greater. It's not as bad as a measles, which is like 18, but it is still very high, and you'll see mass outbreaks, and that's what we saw. And even in June, when the R went up to like 1.5, 1.7, I mean, depending on which ones you look at, maybe as high as 2, we saw explosive growth. So that is something to watch very closely. We reported at the Texas Medical Center. We had a pretty good stretch over the last 3 weeks or so. Unfortunately, it's trailed up a little bit above 1. We've seen that before. A little bit above 1 for a couple of days you can get away with. When you bring it back down under 1, if you keep doing that, it will come back to bite us. So that's the little bit of the caveat is I worry about that a little bit, and I worry that may be an early sign that we're starting to let our guard down. So we got to watch that one, get that down. Tied with that then is the number of positive diagnoses across the greater Houston area. If you look at the schools that have reopened around the world and done so relatively successfully, I'm not aware of a study that's proven there's X or Y is the way to go. But the ones that have been successful anecdotally have had a number of cases per million people in their population, somewhere on the order of 30 or fewer per day. Some have been way lower than that. I think one's 35 or 40. And they've done so largely successfully. This was a lot of people in the May-June timeframe in other countries where school timing is a little different. We're still at 200 something across greater Houston, because we're seeing last week about 1,400 per day, 7 million people. So, call that 200. So we're still several fold higher than what has been successfully accomplished in other communities or other countries. We'll see, we've already seen some of the private school districts or private schools, a couple smaller school districts, easing back in. We're going to see a lot, over the next 3 weeks. But most of the ones I've seen are very incremental, as you said, well thought out, very cautious. They're not just, pedal to the metal day one. And I think that will be useful data to accumulate and see how things go. But of course, that may become a challenge for us, but we'll watch that, and we'll watch that closely. And then of course, HISD has going virtual starting after Labor Day, and right. It's at least October before they go. And that's where you see, hundreds of thousands of kids coming back in. So we'll look at all of that. The third factor we look at is the positivity rate. We use TMC numbers for that. We'd like to be below 5. We're getting really 5%. We're getting really close to that. We're about 5.6, 5.7%, depending which day you look at right now. I can tell you at Houston Methodist, we've dipped now below 5%. We're not where we were in May when things were, going pretty well. We were probably 2 to 3% at that point. I'd like to see it down. We're still at Houston Methodist seeing numbers probably 2 to 3x what we saw in May, which would get us down in that 200-300 range. So, I think we're on the right path. We've got to keep it up. We've got to keep our guard up and keep, our focus, and we can get there. And then when you think about things like you talked about with your church plans, done safely, done incrementally, done thoughtfully, not being afraid to pause if you don't like what you're seeing and you don't see the data, the data is not going in the right way, or sometimes even back off. It will be, I think, logical to try to start moving that way over the course of the fall. I would urge you to take a look at, September 20th. We're not quite there usually yet, but not long thereafter, the temperature starts to get a lot better. So outdoors, we know unequivocally is so much safer than indoors. So where you can look for opportunities to do some worship and some gatherings outdoors on the outdoor basis, that's always going to be preferable to indoors.
Well, it's timely you would say that because we've actually had a strategic meeting talking about, okay, if numbers go back up, then do we just close again? We've got a marvelous front lawn, and we have Easter sunrise service there and other events that we've had. We thought we'll just go outside, and because that is our good weather showcase weather for Houston, typically in the later fall, once you get a little past mid-October, Halloween, it's rather pleasant. So that's definitely in our fallback plan. Speak a word to us about vaccines. What's the progress? Everybody wants to know how are we coming on that.
Well, I think there's cause for a lot of optimism there. The trials that keep coming out, which are now still early trials. Let's be very clear, but they've all been very encouraging. There's really probably 4 front-runner vaccines across in the United States that we're looking at, and probably United States and Europe, and they're being put through rigorous testing right now. Almost all of them look like they will require 2 doses. So they are in what's called a phase 3 trial, which is really after we've kind of tested things out, developed what's the best dosage, looked at early safety signals, looked at early efficacy signals. That's where you get a large enough population to, A, say, is it effective? And B, is it safe? You still don't have, the post surveillance that'll happen over, the course of millions of people to look for the really, really rare side effects. But you'll have, tens of thousands of people to be looking for safety and to be looking at efficacy. All of the early data has been very positive, but we don't have that, that phase 3 data yet. What we do see is that people make, particularly with a couple of the vaccines, very large amounts of neutralizing antibodies, so antibodies to the coronavirus, and that those antibodies are at several-fold the levels of what we would see in a patient with convalescent plasma, that we're using then the plasma to help hopefully treat somebody else passively with antibodies. So that's good news. And a fair amount of the studies, now you're talking about usually in non-human primates, have shown the ability to prevent not just the disease, but the infection, right? So if you think about the flu shot, it does 2 things. For many people, it prevents them from becoming infected. But even for those who do get infected, it tends to, not in every single individual, but across a population, diminish the severity of the illness. Obviously, the best thing from a vaccine is prevent the infection altogether. That prevents it from spreading from person to person. And of course, it eliminates any risk to the individual who has gotten the vaccine and is prevented. A second best is for it to prevent severe disease. So even if you get infected, at least keep you from being really, really sick. We don't yet know exactly how these vaccines will work. A couple of them look to actually, again, in non-human primates, prevent infection altogether, which is very good news. They have all along said that, this fall they'll be getting to that point where they hope to have the data. If you think about it, when we were really, really having high surge was kind of the optimal time to be in phase 3 trials, because what you want is an arm of people who've been vaccinated, an arm of people who didn't get vaccinated, and you need enough disease in the community that, enough people will get sick in the control arm that you can demonstrate a difference. That would have been June in Houston. None of the vaccines were at that point yet. They really only hit the second piece of their double vaccination over the last few weeks. And as this has been going down around the community, not just in Houston, but on average across the U.S., it may slow down the trials a little bit. So, will we see one this fall? Perhaps. Obviously, we've seen a lot of noise in the press about that of late. Preparing for a vaccine, preparing to know how to get it out and distribute it is part of what we need to be focusing on. What we will need is phase 3 data that shows safety and efficacy before we proceed to the next step, which is starting to vaccinate so many people.
Fascinating. To do the trials that you were describing, I guess they need to fly to wherever it's surging, and that's where you start doing the The testing, would that be accurate?
Well, yeah, I mean, they're broad-based right now. They attempt to obviously find communities that, it's a little higher prevalence because, I mean, right, just think about it. If you vaccinate 30,000 people and only 1 in 100,000, I mean, an extreme example, gets the disease, you can't possibly get the data to do that. So, the more disease that's going on in the community, the better. They also work very hard to get a broad cross-section so that, we can answer the question of, does it work in different people the same, or does it work differently in different people? Starts with adults, and then you have to start thinking about, well, what about kids? And you have to think about, obviously, what about the elderly? What about people at high risk? So there's a lot to this, and it's likely, we don't know this, it's likely that, some of the vaccines we use early may not be the same vaccines that we choose to use in a year. And that's why the research is so important, that we follow procedure, that we follow the right ways of doing things, because probably this virus is going to be here with us to stay in some form for a while. We very, very well may need to do boosters or have different immunizations, much like we do with the flu. So we need to continue to learn as much as we can and obviously optimize. And again, some of these vaccines that we do more quickly, we may end up with other vaccines that work better than them 6 months from now and switch, kind of switch horses at that point in time. But obviously the goal now is to find a safe and reasonably effective vaccine and start vaccinating so we can change the dynamic.
I've heard you talk, but I'm going to ask it anyhow. What do you think about the importance of us getting flu shots this year?
Oh, so important. Thank you for asking. The flu is always a very problematic disease. It gets poo-pooed a lot, but the reality is we see lots of deaths from the flu. We see lots of hospitalizations. So I mentioned that, in a normal January, February, at any given time, I'll have 100 patients in the hospital with the flu. So that's not an insignificant number of people. In a bad year 3 years ago, we had about 200 across our hospital system. The mortality of flu for a hospitalized patient is between 2 and 2.5%. Across that 3-year period for us was 2.2%. Not whopping, but that's still decent size mortality. Now, put that in perspective, COVID has 9 to 9.1% across our hospital system. So it's 4 times the flu once you get admitted. And of course, COVID, we've had as many as 850 patients at any given time during that second surge. Today, we have 207 as we speak. And I'm watching because we'd like to break that 2 barrier. We haven't quite gotten below 200 yet. Every time we cross one of those 100 marks, my main operations person and I are always trading emails saying, good, we got a 3, we got a, so we're looking forward for the 2, this hopefully very soon, if we can keep moving forward with all of that. So we need to get flu shots for a few reasons. One of which is, let's not layer flu and COVID, on the hospitals and really be that much less able to care for patients.
So a person could conceivably catch flu and COVID at the same time.
Oh yeah. We saw, when we were still at the tail end of the flu season, we've had, 15 plus people or so not a whopping number, but, because it was the tail end of the flu season, we saw with both. Horrible combination, probably 60% mortality in that population, having the double whammy of both of those infections. So from a personal perspective, you want to prevent it. From a societal perspective, we want to not tax the hospitals to where we're that much less able to care for COVID. And it is so preventable. And on an average year, 45% of eligible adults get the flu shot, which means more than half don't bother to get it. We need to change that dynamic this year. You're already seeing, and you will continue to see, massive push for flu vaccination this year.
Well, you'll be happy to know we at FaithBridge, we are working to be a site where people can get one when they come to church.
That's great. I love it.
We're going to try to do our part because we don't want flu to be springing up. Last question. I'm trying to figure out, I've been reading about the CDC's reallocations of the fatality rates. I think I understand what they're trying to do is sort of carve out with specificity exactly what were the comorbidities. But then I read on social, it was all a hoax like we all said it was. It's not a pandemic. What say you, an expert that's actually down there in the medical center?
Okay, well, if I could safely, I'd walk anyone who thinks it's a hoax through our ICU and show you room after room after room of people hooked up to every machine known to mankind to care for them. The 850 people we had in-house. We've had, as I said, about a 9% death rate across COVID. So we've had hundreds of people die because we've now cared for, as inpatients, over 5,700 people with COVID. This is the real deal. So whenever, I'm a physician myself, and I still practice a little bit. And over my career, obviously, I've signed a number of death certificates. Whenever you're called to sign a death certificate, you try to actually pinpoint the proximal cause of death, but then there's a whole lot of other factors at play, right? So, let's take the flu. A 20-year-old with flu, thank goodness, not many of them will die. Every so often, someone will, and if an 80-year-old with flu is much more likely going to die. Well, the flu is the reason they died because they got admitted, but they were 80. They had lots of comorbidities. So they had heart disease. They had all these other things. And at the end of the day, had they not had the flu, that day would not have been their moment. They might have died 6 months from then, 2 years from then, 5 years from then, whatever. But the flu is the ultimate reason they pass away. So COVID is no different than that. And the vast majority of people passing away from COVID have significant comorbidities. So their death certificates will list COVID, but it will list that they had heart failure. It will list that they had diabetes or morbid obesity or other things that we know have been big risk factors. And, it's the CDC's job to try and make sense of the data. Unfortunately, some people have grabbed that and said, well, a small percentage of people had only COVID listed on their death certificate, therefore the rest weren't COVID, which is completely false. Of the people in our hospital with a COVID diagnosis, probably 97, 98% of them are in the hospital specifically because they have COVID. And the only reason it's not 100 is because we screen. So we will have somebody who comes in for another reason, and we're checking every patient who comes in, and we'll occasionally find somebody like that who's positive. We may cancel a surgery as a result of that, or if they're coming in for something that's clearly not related to COVID, we have to put precautions in place, but that's a very small percentage of the patients we see. And even most patients, let's say, who come in with something like a congestive heart failure exacerbation, if they have COVID, you can bet that COVID is the reason that they have exacerbated and they have sort of tipped over the edge because it's put stress on their body. And so, all of that data discussion is one of those noise issues that tends to happen on the internet. And the reality is, I can tell you, having seen this surge of patients coming in and how sick they are, and how many patients have passed away and how many patients have struggled, it's COVID that's doing this.
Yeah. Well, sure. And so I think with that, let me just say where I started, how grateful we are for you, for all of the doctors and nurses and medical staff at Houston Methodist and all around Houston and all around the world who you're going many extra miles for us as a society. And my hope and my prayer is that people who are faith bridgers at least are doing our part to make your load lighter and to make Houston safer. That's certainly our goal. It's been our goal and it will be our goal. And we owe a debt of gratitude to you for your leadership in our city. Thanks again for the time today.
I appreciate that, and I appreciate the prayers. For those men and women working on the front lines, it's been one heck of a long 6 months, and their burnout, their fatigue, their emotional, spiritual, psychological health is critically important. And I urge everybody to keep doing the right things because we can keep a lid on this, much better than we have. And it will make a real difference in saving lives. And it makes a real difference to those men and women you were talking about there who have really been giving it their all over this time period. So, and they're heroes. I just am in awe of everything they've accomplished.
Well, amen to that. And hopefully all of us will do that. And hopefully the next time that we have one of these conversations, we'll be even getting more good news. That's what we're going to hope and pray for.
Amen.
Thanks, Dr. Boom. At this point, there's nothing that shocking or mysterious about COVID-19, right? It's pretty predictable how it will encroach where it's allowed to, but how we can cut the spread if we will choose to, by wearing our masks, though we hate them, though they're hot and uncomfortable and nobody likes it. But it keeps one's germs to one's self and keeps it all from floating about where people have to breathe it and potentially catch it. And keep our distance and keep our hygiene, keep washing our hands. We can cut the spread and we get the schools open this week. We get the churches open and keep everything open. That's our plan. That's our hope. That's our prayer. You be praying for us as we get ready to open Faith Bridge for all who are able and willing and feel comfortable to come back. Once again, that'll be on September 20th. So that's going to be an exciting day. You be praying for us. September 20th. Have a good night. We'll talk to you soon.